For my career profile, I chose Child Life Specialist. My example organization is St. Luke's Children's Hospital, located in Boise, Idaho. For my career contact, I don't know anyone that is working in this capacity. However, I do have a friend that a couple years ago, she told me that she was going to BYU, Idaho to learn and to study more about Child Life Specialist. And it was at that time that I was able to receive a little bit of information from her about what that is. And I didn't know that that type of job existed. And I was interested to learn more at the time. And when I began my studies through BYU, Idaho, I knew I wanted to do a marriage and family studies major, and was excited when I did some research this week on career options that Child Life Specialist was an option. And so I chose this for my first career profile so I could learn more about it and see if it was something that I might enjoy doing. Some things that I learned about it is that typically a Child Life Specialist is employed in a healthcare setting such as a hospital. I learned that they can also be employed in outpatient settings such as dental offices, hospice, camps, or community intervention programs. I learned that the hours would need to be flexible and may include weekends and holidays. Late hours might also be required in a pediatric emergency room setting. Some typical stress factors that I learned is that it may be more of an emotional stress, as this job requires you to work with children who are facing life-threatening illnesses or surgery. These are high-stress situations for children and families, and it could be stressful to not become emotionally attached to the circumstance and to the children that are undergoing these things in their life. The situations for these families are high stress, and it may be difficult to communicate effectively to them that they could feel your support and help as they undergo these difficult changes in their life. Some typical benefits of a Child Life Specialist include health care, dental care, vision care insurance. I didn't see anywhere where a retirement benefit was offered. I was searching through the St. Luke's website to try and find this information, and I'm not sure if they offer it, but they may. But perhaps you'd have to be a full-time employee to receive a retirement benefit. Some common job tasks of a Child Life Specialist would include psychological preparation for tests, surgeries, and other medical procedures. I found this list on a website, and I think I'll just read it off, seeing that I don't know much about the common job tasks, and I want to make sure to get these right. But they offer support during medical procedures. They provide therapeutic, medical, and recreational play to children. They offer sibling support, also support for grief. They assist in emergency room interventions, offer hospital pre-admission tours, outpatient consultation with families. They also coordinate special events, entertainment, and activities for patients and their families. They educate caregivers, administrators, and the general public about the needs of children under stress. Some educational requirements would include a bachelor's degree in a Child Life Specialist program or related field. BYU Idaho offers the Marriage and Family Studies degree, and I think this would qualify as a related field. After completion of the bachelor's degree, then you would undergo a certification process, which requires an internship of at least 480 hours. I learned that St. Luke's offers internships, and I was happy about that. Following the completion of the degree program and the internship, The candidate is then eligible to take the certification exam. A starting salary range begins at about $37,513. An experience salary range is about $46,097. And then just some miscellaneous career information I found is that the number of child life educator opportunities are continuing to rise, and virtually every hospital in America has a child life educator staff. I was excited to learn about this and think it may be something I might enjoy doing. I think I'll do a little bit more research on my own and continue to look at it as an option.